Okay, today our topic is the basic of stem cell. Actually, it's just a general knowledge about what is stem cell. Since now stem cell is a popular treatment in the whole world, stem cell treatment. So there are a few types of stem cell. The first one, which we are more familiar with, adult stem cell, which is a matured cell. So another one, embryonic stem cell. Then induced pluripotent stem cell, normally known as iPSC, or non-human animal stem cell, from sheep, all this. So what is embryonic stem cell? Okay, embryonic stem cell obtained from human embryo from the time of IVF until 8 weeks of the gestation. Means when a sperm meets the eggs fertilize and become embryo up to 8 weeks. The stem cell that extract from it, we call it embryonic stem cells. But nowadays, actually for the past maybe more than 10 years, it's not popular anymore because it is not differentiated and very potent, as in there is a risk of mutation. Means mutate change from original form to other type of cells. Means mutation might occur. It's non-ethical. Okay. Next is adult stem cell, which is currently most of the centers are offering this. Undifferentiated cells found in differentiated tissue or organ that can renew itself. So it can maintain and also repair the tissue. All these are matured cells, so we don't need to worry about the risk of mutation. So there are a few types of adult stem cell. So first, hematopoietic stem cell, which the origin are from bone marrow. Okay, the generally we know is the bone marrow transplant in leukemia or some of the bone marrow or blood related disorder. Okay, neural stem cell. Okay, neural stem cell made from a nerve. All these are good for more suitable for neural disease. Means like maybe a stroke or any what you call this, cerebral diseases. Okay, but it's very limited, the cells. The next one, skin stem cells. So just from the skin, then umbilical cord blood. But nowadays, for the past maybe 5 years, umbilical cord blood becoming not so popular as there's a lot of limitation and the number of stem cells actually is quite low. So the next is epithelial stem cells, which are also not so common to use. Mesenchymal stem cell. Mesenchymal stem cell is currently the most popular in the market. Okay, mesenchymal stem cell like rotten jerry cells or even fats origin stem cell. All these are mesenchymal stem cells. So next is iPSC, induced pluripotent stem cell. For past few years, it began to gain some popularity, but generally used more on developing a drug. Because what is iPSC? Means a specialized adult stem cell are reprogrammed genetically. Means there's a genetic modification are introduced to the cells. So some of the study actually show that it might have a risk of causing mutation as well. Which mutation we always worried the most is becoming a cancer, developing a cancer later on. So normally used more in drug development. So and next one is non-human or animal stem cell. It's still widely in the market, but generally in supplement form or tablet form, so-called this. But this is a general knowledge. Normally stem cell be looking at as a live stem cell, then only can serve then can give the prepare repair ability, have the repair ability, have to be a live cells. So normally all these animal stem cells that they put in a capsule form is normally what we call is stem cell extract. So, and generally all these extract stem cell, animal stem cell extract, they don't contain live cell anymore, okay? But it contains a lot of animal origin of hormones. So definitely after you consume, you feel the difference, but in the long term, it's not so advisable because it's animal origin. When animal hormones, what in medical we call it synthetic hormones as well. Okay, and when it comes to animal stem cell in a live cell form, means injectable form, actually for the past few years, it also start to lose their popularity because of the risk that it might cause. Okay, because the origin is animal and we are human. So it might destroy our system, especially our limb system, causing injury to our limb system, and maybe later on we develop cancer. Actually, a lot of ongoing study already showing this, and definitely it will cause rejection as we are human. So why stem cells are so amazing? So it's because of its unique properties. Only stem cell can differentiate into specialized cells. Okay, means it can repair. Okay, repair the injured cell, then come back to normal. And another one is cell renewal. Okay, means producing a daughter cell of the same as the original cell. In another word, is regeneration property lah. That this is where it will give recovery, okay, the repair properties. But of course, the stem cell have to be a live cell. Okay, means a live cell means you only can extract freshly from the donor or the person body, freshly extract out, process that introduce back to the body, or the other source is get from lab, that we call it cultured cell. Only these two sources. So those that you get from supplement form, capsule form, or even some diet drink or supplement drink, all these are not stem cell. Stem cell have to be live cell. If all this found in supplement or capsule, all this we call stem cell extract. Or it doesn't have the regenerative properties, means it can't repair. Okay, just like you're taking a supplement, it wouldn't give a repair. It wouldn't give a repair. It wouldn't repair the damaged cells in your body. Okay, but it does give so-called this good effect. Okay, all this good nutrition. Even some of them contain some hormones. Okay, then definitely after you consume, definitely you feel better, but it doesn't give you the regeneration. Means it doesn't repair. It won't give the real healing. Okay, so now in the market or in the world, why stem cell treatment gain the popularity? Because of course it's property, and people go for this stem cell treatment is for therapeutic usage, means treating a disease or for anti-aging purpose, means to maintain good health. Okay, so for therapeutic purpose, normally the diseases that normally come to a doctor and they are requesting for the stem cell treatment, the disease generally are those stroke, autoimmune disease, osteoarthritis, or what we can say is that some of the disease that we can offer stem cell treatment are all these diseases. Okay, but advisable not to go for stem cell treatment when their organ damage occurs. Means the end organ already have some degree of damage. Means the result maybe wouldn't be so promising. Okay, so all this for therapeutic purpose, clinician, we are doctor, we have to consider what's the number of the cells that we want to use. Minimum, normally is minimum 100 million cells count we have to use to give to achieve the desired result. Okay, and also route of deployment of stem cell. Let's say for osteoarthritis, we need to direct inject the stem cell into the joint. Let's say the knee is for knee, then we inject to the knee joint. Maybe some for the hip joint have to inject straight into the hip joint. All this. Then also the numbers of deployment does matters to give to reach the desired result that what we want the patient to achieve. Okay, so normally patient that have all these diseases, they will come to us, which for mainstream medicine, normally for mainstream medicine can't really help the patient, like autoimmune diseases, thyroiditis, okay, psoriasis, SLE, or even rheumatoid arthritis. We all know that if by mainstream medicine, normally you give the medicine to prolong the duration of the disease, but it's very impossible to achieve full recovery or even just 50% of reversal. Okay, so with stem cell treatment, and of course on top of that with some nutrition and hormones, we can reverse the whole disease back to normal. Okay, so another one is stroke. Stroke is basically stroke is just injury inside the brain. So how to repair? Only by stem cell injection. Otherwise, for mainstream medicine, actually it's very difficult to, or near impossible to recover. Okay, next, osteoarthritis. So you know that for mainstream treatment, maybe in the early stage of osteoarthritis, they give you painkiller, some joint supplement, then injecting local anesthetic medicine, plus HA inject to the joint, but all these are not long lasting. Okay, maybe last for 6 months or 1 year. Eventually, if you become severe, okay, then severe, then the orthopedic surgeon will advise you to go for total knee replacement, all this. But first, you have to understand that osteoarthritis actually is a degenerative disease. Means anyone actually will get this. Okay, or sooner or later you get this. It's a aging disease. So normally what you do, of course, in the early stage you come for stem cell treatment, the result will be better. As the simple is because lesser part to repair, okay, the chances to have a full recovery is higher. So maybe those more severe one, you require a few session of stem cell injection, okay. Of course, all these are reversible, means you can do many times of injection, you still have your own knee joint. Let's say if you go for orthopedic surgery, you go for TKR, that one is non-reversal. Okay, and on top of that is a surgery. There's a time you need quite a long time to recover. Okay, so other than that is diabetes mellitus, all this, it can reverse back to normal as long as before. I would advise is before you actually develop kidney damage, then you come for, or even the early stage of kidney damage, still reversible. Okay, then after stage 2 to 3 kidney damage, actually is the chances to have better recovery is very low, the percentage. So next one is gout, severe gout. We all know that gout eventually will lead to kidney damage and even hypertension. So all this is, we advise come as early as possible, reverse 100% so that it won't cause further end organ damage. Okay, for anti-aging purpose. So all this, for anti-aging purpose, we recommend patient to come to us as early as possible, as in they are still healthy. Healthy as in no end organ damage. Okay? Of course, if you do it when you are still healthy, you actually can maintain your health and youth longer. Okay, maybe later on you have question you can ask me. Because to increase vitality, strengthen immunity, especially at this period of time, or maybe the next 6 months to even up to 2 years, is very important as we are fighting against coronavirus. We need a strong immune system. Okay, so that if so unlucky that we contracted the virus and we won't progress into complications. Okay, so next can enhance our sugar metabolism. As we age, our body capability to metabolize sugar actually become very low. Means we can't metabolize the sugar as what we used to when we were at younger age. Okay, in terms of because our cells are aging, means our hormones secreted are lower, okay, and our absorption is low. Of course, all these are reversible, okay, with our anti-aging treatment. Okay, so next for anti-aging purpose also to treat the inflammation. We all know that inflammation is the injuries inside our body. It's a start of any diseases or even cancer. Okay, injuries in our body which we cannot feel. Okay, let's say we have cut on the skin, we can feel, but we have injuries inside our body, inside in our organs, in our cells level, we can't really feel it. And all these are silent killer. Of course, when we do blood tests, we can measure our inflammation level from some of the parameters. And all these are reversible before it develop into a disease or cancer. Okay, because the next is because we want to restore body system. Our every system have a specific function, can restore it. So actually now many of my patients will ask me, so what's the difference from us from other clinics, or why they should choose our clinic to do anti-aging treatments rather than others? Because at the moment, actually, all stem cell treatments in the whole world for anti-aging purpose are still considered under research. Okay, and I don't think in the near future it will become a registered treatment. Okay, registered treatment means we can get from hospital. Of course, a lot of ongoing research now that showing a lot of good results. Okay, and even a lot of testimonials or given. But for medical system, for this to becoming a registered treatment, you have to go through a long process, including a registry, you have to do form, clinical trial, all this clinical data, it's a very long process. And mind you, because stem cells are natural products, so it can't be patented. So it can never become solely owned by a company. So I don't think with this that I don't think it will becoming a registered treatment. So the challenging part is how to make the result be effective and long lasting. This is the most challenging part. Some of the patients after they undergone stem cell treatment, definitely they will feel the immediate or within 2 weeks they will feel the changes. They feel more energetic, all this. But I will tell you, all these are just a short-term changes. Okay, and but it's a good reaction. Okay, but what we want to look at is a long-term thing. Maybe after 1 year, you still look back or you compare to the same age group, you still look, you still feel good, you still feel energetic, you still healthy. All this long lasting, not even 1 year, after 3 years, 5 years. Because it's not as simple as just a stem cell injection. Okay, in order for stem cell to give the best result, we have to provide the optimized environment for the stem cell. Okay, what is the optimized environment? Okay, literally how stem cell work. Once the stem cell injected into our body, it actually will create a signal in our body. I'm talking especially in anti-aging, for anti-aging purpose. Okay, and every part of our body actually contains stem cell, but the stem cell that inside our body are as old as us. Okay, they become lazy, they become slower movement, not so active as last time. So we need this signal to come in and wake up all the cells. So all these cells in our body will be waken up and do the job. Okay, stem cell, what's the main job of stem cell? Is to repair our body. So once the cell become active, like a child, what they need the most? They need food. Okay, this is the environment we have to provide to the cells. They need food. What's the food for the cells? Are all these micronutrients, nutrition, minerals. All these are the food for the cells. Okay, next, just like a car need engine oil. Okay, then our hormones are function like engine oil. Okay, to our body to make sure all the system work normally. Okay, third, we need to have a good rest. Just like children, the child they sleep more than adult because they are growing. Okay, they are active. So same like for all these stem cells just waken up in our body. So for nutrition hormones, we need to optimize the level. What is optimized level? Everyone have a different level. This level might be good for you, might not be good for the other person. So everyone have a different level. Okay, so we need to find the optimized level for each of you. So all the treatment you can say is a personalized treatment in terms of our nutrition, hormones, even the stem cell injection. We would to inject the cells. Okay. So hormones, there's many types of hormones in our body. Everyone has a different level. Okay, this is what we can do for us clinicians to tell you what to do. Another one we need to advise you what to do is how you want to eat. What's your diet? Okay, how to choose your food. Okay, then exercise. Even exercise, we need to teach you literally how to exercise. Okay, not like last time I think many years ago when I haven't started to practice all this, I was a doctor in in government clinics. So normally patient come to us, you say, oh, your sugar control is not good. So what should do? Control the diet, do exercise. Actually, we leave the patient with don't know how to do, and they just go back and continue back what they used to do. So it never improve. Okay. So even now, even exercise we prescribe. Tell the patient, you today morning you do what, night you do what, or evening you do what, how you do. Okay, you should do what kind of exercise. Then diet, you choose this kind of food. What food you should avoid. All this. So we check diet, exercise, all this in detail and teach accordingly. Okay. Next one is stress management. Everyone has their own stress. Okay, the stress can be from your spouse, your children, your parents, from your work, from your colleagues, all this. Everyone has the stress. But how you want to manage it, that's the key. Okay. Then everyone has a different type of management of stress. Maybe some like to sing to release the stress, some like to go to exercise, or some other thing. But we will advise to do something that can contribute to your health. Go for exercise. Instead of some go for heavy drink or smoking, all this. This is bad. Okay. So the next, which wouldn't give any benefit, is smoking. So we will help the patient to slowly cut down the cigarettes, or if the patient can quit totally, then we quit, that is the best. Okay, moderate alcohol consumption. Okay, and choose what you drink. Only we advise you want to drink, try to go for wine, brandy, all this because are made of grapes, so contain some antioxidation. It's antioxidant agent. Of course, the last one is no drug abuse. Huh? Okay. So basically, it's a very short introduction about what is stem cell. Just a few points that you need to know, because in the market, many products that claim they are stem cell. The easiest thing to differentiate is stem cell must be live cell. So how can a live stem cell be to stay alive in a capsule or in a bottle form or supplement form? Okay, so all these are not stem cell, and it won't give regeneration. Means it cannot repair your body. Okay, so second, because for the past so many years we have we have come across all these cases, we realize that to achieve a good result, definitely your nutrition and hormones have to be optimized. If not, the result won't last. Okay, just like a kid, if you don't give food, the kid cannot grow. Okay, it is stunted. Okay, is there any question? So, if there's no question, maybe we can watch a short video.